Now to a group of people that are getting some attention when it comes to the topic of vaccines: inmates. The CDC says that inmates and those who work in correction facilities should be among the first vaccinated, a guideline many states are choosing to ignore. Now there's a brewing public health debate about putting inmates at the top of the list when some say they should be last.
They literally leaving us in here to die,
This is Aaron Campbell, an inmate at FCI Elkton, a low-security federal prison in Ohio.
He on his deathbed.
Back in April, recording on a contraband phone, Campbell claimed the men in this video were showing signs of COVID.
Then they told me to stay 6 feet, then they gave us these motherfucking masks and literally said good luck.
Some of the country's worst coronavirus outbreaks have been in prisons. 356,000 inmates have tested positive for COVID-19, with more than 2,000 reported deaths, according to the Marshall Project. After taking this video, Campbell says he was put in solitary confinement for using that contraband phone. He told reporters that officials said he would not face additional punishment if he claimed the video was fake. He declined.
This ain't no joke. None of that. This is for real. It's me for real. You feel me? They out here dying, bro.
Now that Pfizer and Moderna have both authorized vaccines, many healthcare professionals and social justice advocates want to know when this vulnerable population will get theirs. Although CDC guidance put correction officers and inmates with frontline workers and people aged 75 and older at the same time or in the next phase to get vaccinated, states like Colorado have ignored that recommendation.
That won't happen. There's no way that prisoners are going to get it before members of the vulnerable population.
So far, only 8 states have given high priority to incarcerated people for the vaccine, with 10 states giving them no higher priority than the general population.
Vaccination is about not just hitting one population, but hitting those populations especially first that we know are most at risk. Of the 20 biggest clusters of COVID cases, 19 were in incarcerated settings. That is really frightening data to me. And we've seen that in those states where we see higher rates in incarcerated settings, we also see higher rates in those states themselves.
Inmates are one of the most vulnerable communities to COVID-19 infection, confined in close quarters that can be difficult to disinfect.
It's not like there is hand sanitizer everywhere, and sometimes people have to pay for soap.
The director of the Arkansas Department of Health claimed these outbreaks are isolated, with no effect on their outside communities.
The fortunate thing about that kind of setting is that it's not that hard to contain it because people aren't going out and about. They're not leaving the prison.
Only people are going in and out of prisons and jails every day. An estimated 445,000 people work in U.S. correctional facilities, and more than 94,000 of them have tested positive for COVID-19.
So you have staff, which includes the correctional officers, maintenance crew, healthcare staff, anyone else working in custody. But then on top of that, you have attorneys and police officers who are coming in and out all the time, and then they're going out to the rest of the community.
But that's not the only way coronavirus can spread. Notoriously overcrowded, jails and prisons often transfer inmates as a way to alleviate their numbers, including potentially some with COVID. In late March, former Attorney General William Barr directed the Federal Bureau of Prisons to begin identifying inmates who could safely be released to home confinement. Among them, former Trump fixer Michael Cohen and Trump ally Paul Manafort, though they are the exception and not the rule. Many state officials are now up in arms over prison releases, expressing concern over what crimes fit under the nonviolent criteria in Barr's memo. In Texas, Governor Abbott issued an executive order barring the release of violent offenders, arguing that it would not only gravely threaten public safety, but would also hinder efforts to cope with the COVID-19 disaster. Since last spring, the prison and jail population dropped by 11%. But confusion over the conditions for release has left many high-risk inmates still incarcerated.
A lot of states have had 24-hour lockdowns. People are in 6x10 cells. Some people in bigger cells are sharing cells. That is breaking people in prison. That is doing long-term irreparable damage to the mental health, the physical health of those individuals.
Ashish Prashar is a social justice advocate who himself spent some time in the UK prison system as a teenager for theft.
The danger of the virus poses means that even a minor offense or a minor accusations, people who are in jails because they couldn't afford bail, could lead to getting locked up with a potential death sentence. You know, people have died without even being convicted of anything.
In Texas, 80% of inmates in jail who died of COVID-19 had not been convicted of a crime, according to a report by the University of Texas, Austin. California native Dante Westmoreland was on his way to visit colleges with friends when they were pulled over in Kansas for having a dirty license plate. Police found a pound of marijuana in the trunk of the car Dante was riding in. They ultimately charged him with possession and intent to distribute, and he was sentenced to 7 years in prison.
I was sentenced to serve nearly 8 years for a first-time marijuana offense with no criminal history.
Although his conviction was later thrown out, for the nearly 4 years he spent in prison, not only did his grandmother die, forcing his 2 brothers into the foster care system, but he also contracted COVID-19.
So as I'm sitting back with the virus and I say, what do I do next? What's the future for me? It's like I'm on death row minimum.
Now, some individuals who either not had the experience of working in corrections or having someone close to them be incarcerated would think, well, these individuals have done something wrong, and so why should they be the priority? But in reality, you don't know who's done something wrong, and because they've done something wrong, does that mean that they get a second sentence?
Melissa Love's sister, diabetic 61-year-old Darlene Lulu Benson Say, was the first female prisoner to die of COVID-19 in the state of New York. Lulu began emailing her sister around the beginning of the first wave back in March. Once she contracted the virus, her roommate then stepped in and began emailing updates to Melissa. Although they have since been deleted from Bedford Hill's database, Melissa had taken screenshots to document what her older sister had gone through.
Sometimes wonder, like, did they have a plan of action for the people in prison? Because they are so vulnerable to this disease.
Lulu died alone, the prison not allowing her to video chat her family without prior approval.
And it's just really sad that we one day hoped that she would come home, and we could start this new life, and we had all these plans of what we were gonna do. She loved to eat barbecue. Of course she was having a big barbecue party, but that didn't happen.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.